Welcome, everybody. Today we'll be reviewing a powerful communication framework that can help us resolve the vast majority of patient dissatisfaction that we encounter. It's our 4-point technique. It's not about spending more time with each patient. It's about using the moments we already have with more intention. I hope you find this helpful. So why does this matter? Because more than 75% of our negative comments have nothing to do with medical errors or clinical decisions. Instead, they reflect a breakdown in communication or the patient feeling like they were not respected. How we make patients feel, essentially. And so that's the good news. These moments are fixable with small, repeatable habits with our 4-point technique. Let's review the 4-point technique. There should be flyers on your desks with these points printed. The first one is first impressions matter. So your body language and the presence sets the tone from the moment that you walk in. It only takes 7 seconds to make a first impression. So make sure that you have an open body language, just a gentle touch, like just a brief little pat on the shoulder, eye contact, sit when possible, and smile. That sends an immediate message to them that you're a warm, friendly person that is here to help them. The next thing is discover the main concern. Just point blank ask them, what is it that brought you here today that you're most worried about? Ask what is worrying them the most. It shows that you're there to help, not just to diagnose. The third one is blueprint the visits. Explain what's going to happen next during their care. Tell them what's just going to happen. Patients fear the unknown, and having a little bit of an idea what's going to happen will help them a long way. And finally, just ask what we call the magic question before you leave the room. Do you have any other questions or concerns? That one question can make all the difference in when it comes to patients having negative comments. Let's take a look at the first comment from last month. The comment from the patient was, he came into the room and leaned up against the wall and crossed his arms and started talking. He didn't look at my knee, not once to see if something is there. He simply sent me away. So the missed techniques, obviously a first impression, open body language. When we cross our arms, we're just sending a message that we're just not really listening or interested in what you have to say, which may not be true. It's just that that's the message they get with our body language. And the second one, we could have discovered the main concern. What is it that you're worried about? The patient could have said, oh, I'm worried about this or that with my knee. So in this case, poor body language and a lack of physical exam made the patient feel dismissed. A calm presence, eye contact, and a quick exam, regardless of clinical necessity, can completely change how a patient interprets your care. They don't want perfect answers. They just want to feel like they matter. Let's look at the second comment. Uh, Doc really didn't listen. I informed him I just had a tonsillectomy and he's still pressed to feel my neck lymph nodes. They gave me a script and did nothing else. Didn't mention med interactions. So some missed techniques. We didn't discover the main concern. We didn't blueprint the visit as to what was going to happen or why. And we didn't ask the magic question. So in this encounter, the patient felt ignored. Even after disclosing that they had had a recent surgery, they felt unsafe when we didn't acknowledge medication risk or explain the plan. A simple blueprint of what we were doing and why, combined with a closing question to check for concerns, would have turned this into a positive visit. Okay, let's briefly look at the third and final comment. The doctor just walked in, looked in my throat, said he'd prescribe a steroid and antibiotic, and walked out. Didn't say what I had or if I had any questions. So missed techniques, discover the main concern, blueprint the visit, or why you didn't do test, or why you did what you did, and ask the magic questions. Do you have any other questions or concerns? This is a very common one. The visit was fast and technically appropriate, but no communication left the patient feeling completely unsatisfied. A brief comment about the diagnosis, why you're prescribing, and that final magic questions, any concerns before I go, can turn a sterile interaction into a human one. We review all the patient comments every month, and there's always a common thread in the bad comments across all of these comments, the common threads are clear. Patients feel unheard, unclear about what's happening, and unsure if their voice matters. All of these issues are solved by consistently using our 4-point technique. The great thing about why this works is because it's a reliable and reproducible method to use with every encounter. This approach is efficient. It's not about adding more time to your shift or your patient encounter. It's about doing the same things with greater intention. These steps build connection with the patient very quickly. They build trust and satisfaction without us having to spend any additional unnecessary time. Patients leave feeling respected, heard, and informed. And when we apply them, I promise you they work. The good news is that we're very close to our goal that our market has set for us. Most sites are nearly or at target. We typically miss it every month because 1 or 2 facilities are below the goal, or 1 or 2 providers are dragging everybody's scores down. So if you happen to be an outlier, please apply these principles. It has nothing to do with how good a clinician you are. Nobody teaches us this stuff in med school. It's something that we have to kind of learn. There's a big body of literature on this, and this is a very simple thing that we can use to improve this aspect of our practice. Your words, presence, and body language matter more than you think. So the takeaway is, let's all use this 4-point technique. Remember, first impression, use open body language, gentle touch, eye contact, and whenever you can, sit down to get that immediate sense of trust. The second point is discover the main concern. Point blank, ask them, what is it that brought you here that you're worried about? We want to make sure that we address your main concern. Do a quick little blueprint of the visit, set the expectation of what's going to happen and why, takes just a few seconds, and finally ask the magic question before leaving a patient's room. Do you have any other questions or concerns? First impression, main concern, blueprint, magic question. These small moments are often the ones that matter most to patients. Make it a habit. You'll see the impact immediately in patient connection and in their feedback. Thank you so much for helping us on this front.